Okay, so can you see the screen? Thank you. All right, so we'll go ahead and get started. Thanks for Turtle and uh, Suspicious Bunch for setting this up. Thank you for having me. My name is Singh, and I am a Naplex tutor. I've been doing this for a couple years, and I hope to share my insights with you. If you have any questions, please save them uh, for after the presentation. Make a note, and we'll touch on this topic of weight loss. And I'm just going to plug myself and my services. If you're interested in one-on-one tutoring, let me know. Feel free to reach out. My website link is in the introduction. And if you want to join a small group of 3 to 5 students, also let me know. We'll be starting that hopefully Thursday. A couple of you have reached out, and I'm just getting that set up and trying to come up with timings that work for the most. And once one group fills, we'll start another one and just go from there. We do have two dogs. If they bark, I apologize in advance, and uh, we'll go from there. All right, so welcome. The resources that I use are RxPrep and Pass Naplex Now to make this presentation and to work with you. I think both of them are great products, and both of them will give you a good result if you put in the effort. And always remember at this level of your education that quality is what matters, not quantity. And so if you think, oh, I'm going to study for 8 hours, that's great. If you can't recall what you studied, then that's not that's not good quality. So keep that in mind. And also remember there's a lot of information that you're putting together as you have over the years of your schooling. And if you have a air quotes bad day, I'll turn on the video. If you have a bad day or you're struggling, remember, give yourself some grace. Okay? All right, let's start with weight loss. So, a little bit of background. We have the guidelines are BMI 25 to 29.9 kilograms per meter squared is overweight, and 30 or above is obese. I don't think clinically it's the best standard of measurement. For example, I'm 6'1", 205, and my BMI is 26, but I don't really get a lot of comments when I get my yearly physical on being overweight. So, uh, but for test purposes, keep this in mind. Overweight patients are at a higher risk for several comorbidities, being type 2 diabetes, stroke, hypertension, coronary heart disease. And for weight loss to occur, it's like a mathematical equation. You either have to reduce your intake or increase your calories that are burned. And in some cases, you need to do both. You need to increase the calories that you're burning or the physical activity, and you need to be in a calorie deficit. The mechanism for most drugs is going to be either we're going to decrease the appetite or increase the feeling of satiety, which is the feeling of fullness. If you've ever had a very nice meal and someone says, "How are you feeling?" and you say, "I'm satiated," that's that feeling of fullness. And if there are any medical conditions, for example, hypothyroidism, uh, that needs to be corrected. And if there are any medications that your patient is taking and there's an adverse effect of weight gain, we need to stop those. And there are certain medications that we'll avoid in patients that are overweight or obese that have the adverse effect of weight gain. Now, a short list of drugs that can cause weight gain. These are both in past Naplex now and RxPrep highlighted. And um, please make a note of this. I know an upload, sorry, this is going to be uploaded later, but if you'd like to take a screenshot, that's a good idea. Antipsychotics, clozapine, olanzapine, risperidone, quetiapine. These actually, not just in weight loss, but all four of these are very high yield medications, both in psych and um, elsewhere. So keep that, these are important to know. Drugs that we use to treat diabetes, insulin, sulfonylureas, malignity, and TZDs, thiazolidinediones. Now, the good thing is nobody's being graded on pronunciation, so that's always a good thing with the big names. Next, we have valproic acid and divalproex from the neuro chapter, pregabalin and gabapentin. Lithium, which we use for bipolar disorder, has an adverse effect of weight gain, as well as the SSRI paroxetine. The other SSRIs may be weight neutral, and you may get a test question. Oh, sorry. Sorry, let's see. It says you can't see the screen. It says we pause this preview. Just a second. Is the screen back? Okay, thank you. I think I have to move the mouse when it says pause. Thanks for bringing that to my attention, everyone. So, you may get a question that has the SSRIs and it has several choices: paroxetine, fluoxetine, duloxetine, but paroxetine is the number one SSRI for weight gain. Next, we have mirtazapine, vasodilators, then there's steroids, dronabinol, and um, TCAs is a big one, amitriptyline, nortriptyline, and then last but not least, we have the MAOIs as well as hormones. A common question, uh, not just in the test, but for patients if they start, let's say, oral contraceptives. Um, Turtle, I'm on PC, and they'll ask about weight gain, and there is weight gain and there is fat redistribution. So, important counseling point, keep that in mind. Okay, next, treatment principles. We have ACE, which is the American Academy for Clinical Endocrinology. They have certain recommendations that we follow for Naplex. And this one, these are going to be reduced calorie diets. And several examples of reduced calorie diets are DASH, low carb, low fat, vegetarian, Mediterranean, and there were a few more. They need to be individualized based on the patient, with keeping in mind you're not just reducing the calories, but for example, if you've ever had like a ramen noodle packet or one of those cups, they may only have a few hundred calories, but they'll have half of your daily recommended allowance of salt or sodium. So a well-balanced diet needs to be developed. Physical activity, 3 to 5 days a week, 150 minutes or more per week. Now they say if you have a sustained workout of 30 to 45 minutes, it raises your metabolism for up to 36 hours. So you may know somebody who works out every other day and looks great, and that's the one of the principles that they may use. Continuing our non-pharmacotherapy, we have self-monitoring or journals, goal setting, stress reduction, stimulus control, and then social support such as group therapy. We're only supposed to start pharmacotherapy if lifestyle changes don't work. And looking at the OTC supplements, you have bitter orange, caffeine, yerba mate, guarana, green tea extracts. And you have to remember that these are not recommended in heart disease and hypertension patients. The mechanism of action of why, especially with caffeine, green tea extracts, is a tested concept. So please make a note of that when you're doing your review. Prescription meds. They're not appropriate for small amounts of weight loss or as needed use. And PRN has a basis in Latin. I don't remember. Bonus points if you do, but it does mean as needed. And so you can't say, oh, I gained a few pounds this week. I'm going to take a prescription drug uh, and stop it when I'm done. And you should counsel the patients to rely on lifestyle modification. The guidelines here are BMI 30 kilograms per meter squared or higher, or if they have a weight related condition or a comorbidity, then you can use the guideline of a BMI over 27. Now, along with prescription meds, the patient needs to commit to dietary modifications and increase physical activity. So, older stimulant drugs like phentermine are used to jumpstart or in the short term. And so, like for a month or 2 months based on the guidelines and their goals. The newer agents like Kismia, Contrave, Saxenda, Wegovy, Ozempic, they can be used long term. And the target should be at least 5% weight loss at 12 weeks. So if you get a test question and let's say the patient is at 300 pounds, and so 5% of that will be 15 pounds. If they say at the end of 12 weeks they've only lost 8 or 10, probably one of the choices to either revisit or review their plan is appropriate. All right, very good. Next, we have avoid or caution. Pregnancy, you're going to avoid all drugs. Hopefully, we all know that in pregnancy, weight gain is a good sign, means that your unborn child or the fetus is growing, and weight loss is not indicated in pregnancy. Number two, hypertension. So Contrave is contraindicated due to bupropion, and Kismia is also, you need to monitor the heart rate because phentermine is a stimulant. Depression. Contrave, due to bupropion, can increase suicide risk. Contrave also has uh, a caution for seizures because it can lower the seizure threshold. And if they're on Kismia, we taper slowly due to topiramate. Opioids, because naltrexone is in the formulation of Contrave, it'll block receptors and patients will have breakthrough pain. Now, important drugs. I kind of ran out of time. I had a full schedule for this presentation, but tomorrow and the rest will be a little more comprehensive. The important drugs, and what I mean by more comprehensive, we'll discuss black box warnings, the mechanism of action, important interactions, um, moving forward. But these are the important drugs that were listed in both RxPrep and Past Naplex now. We have stimulant, which is phentermine, and it is a Schedule 4 controlled substance. Mhm. Contrave decreases the appetite through bupropion, and naltrexone decreases the cravings. We have GLP-1 agonists, lipase inhibitors, which is orlistat, available in the brand name Xenical and Ali. We have appetite suppressants. Phentermine is in a formulation Kismia, and we have lorcaserin, which is Belviq. Another, oh, let's pause it once again. Let's see if I can fix that. Can everyone see the slide bariatric surgery? Okay, very good. Thank you. So, uh, the indications for bariatric surgery are BMI over 40 or 35 and above with an obesity related condition, such as a metabolic syndrome, gout, joint pain, hypertension, diabetes. There's a list of obesity related conditions in both resources. So, the mechanism of action for bariatric surgery would be restricting food intake, either through removing a portion of your GI or banding. And after surgery, patients must commit to healthy eating and exercise. I don't know if anyone has seen the show This Is You, This Is Us, but in there, one of the characters falls into this category, goes to group therapy, and someone talks about bariatric surgery. And in the consult, they talk about because your stomach is so small, if you eat too much, you become violently ill. And so committing is a little involuntary in this case because you can only eat so much. And so patients learn to eat less and enjoy more. Exercise as well is part of that lifestyle change. So, a couple things to highlight here. Nutrient deficiencies. Calcium is a big one because it's mostly absorbed in the duodenum or duodenum, however you like to pronounce that portion of the GI. And calcium citrate is preferred for non-acid dependent absorption. Now, hopefully you've come across the different forms of calcium and the different amounts of elemental calcium. That is a highly tested concept, and calculating the different amounts is important. Next, we have vitamin B12 and iron deficiency. These can cause anemia. Both are different, but both need supplementation. Okay. Next, we have iron and calcium, and these supplements need to be given 2 hours before or 4 hours after. I think the last 10 or 15 students that I've had for Naplex have all told me after the test that they had a question about antacids and the effects that they had. And so whether it's binding or how it binds, that's important to know. Please make a note of that. So I put the Y. Little homework for y'all. Next, we have fat-soluble vitamins, which are A, D, E, and K, and these are required supplementation for the rest of the patient's life. This is because there is malabsorption of fat, and therefore whatever is dissolved in in that fat cannot be absorbed. When a patient experiences rapid weight loss, gallstones can form, and so orsodiol with the brand names Actigol and then Orso, and there's a couple of them. I think Forte is one of them, Orso Forte, and I know there's another Orso as well. These dissolve gallstones. Curative is gallbladder surgery, and some patients have already had their gallbladder removed, so it's not something you need to worry about. Key counseling points. Weight loss can improve the comorbidities that occur. So, whether it's diabetes, high blood pressure, joint pain, metabolism, and a positive effect on mental health. We've probably heard, hey, go work out, um, you'll feel better, and that's because your body releases endorphins and enkephalins, which are neurotransmitters that have a positive effect on our mood. Next, we have kismia, which is phentermine and topiramate. We counsel the patient to take in the morning and avoid in the evening because of insomnia being a possible adverse effect. Contrary, naltrexone and bupropion. Do not take opioids or if the patient has a history of seizures. If you recall, it can lower the seizure threshold, uh, and that's bupropion. Orlistat, which is the brand name Xenical and Ali. Excuse me. Take one capsule with meal or up to 1 hour after your meal, and you want to eat a healthy diet, which is low in fat. This, because it absorbs the fat, can cause GI issues that a patient will complain about. And depending on how bad this adverse effect is, it can affect their quality of life. One being increased number of bowel movements, and gas or bloating, and fatty and oily stool. And I left off a parentheses at the end. Okay. GLP-1 agonist. This is a sub-Q delivery method. It can cause hypoglycemia, pancreatitis, nausea, and if the patient is taking a GLP-1 agonist already for diabetes control, we will not prescribe another one. And then last but not least, we have appetite suppressants. These can cause increased blood pressure and increased heart rate. And now we have a practice question. And this is covers area one. And one thing I like to do in my sessions is, and you may have noticed in the chats, I ask for us if you've taken the test already or if you have a practice test, let's look at your score report and discuss the different areas, what they're asking for, what they need, and if you've taken it, how you can improve those areas. And Suspicious Bunch has a great guide with a very comprehensive breakdown that I recommend to everybody, both on Discord and on Reddit. And please review that. It is gold. And so this question covers area one, which is obtaining, interpreting, or assessing data, medical or patient information. And this is approximately 1/6 or 18% of your test. Just to recap, the 6 areas of competency, you do need to pass all of them and score a 3 or better. So the practice question, I'll read it while everyone takes their time uh, and if you would like, when I'm done reading, then you can start putting your answer in the chat, just to give everyone a chance to formulate their own. And if you're, depending on where you are in your stage of prep, if you're not sure, once I stop reading, go ahead and make a guess. Use what you know to do the best that you can. Hype up, hype up, go. A 48-year-old female comes to your ambulatory care clinic for a follow-up appointment for weight loss. She has implemented strict lifestyle changes for the past 6 months, but is still unable to lose weight. She is frustrated that she has not seen improvement with her efforts and asks if there is a medication she can take to help with her weight loss. Vitals include a blood pressure of 165 over 100, heart rate of 72, afebrile, and a respiratory rate of 13. Her past medical history includes obesity, hypertension, heart failure with preserved ejection fraction, HFpEF, depression, seizure disorder, and liver disease with cholestasis. Her home medications include lisinopril 40 mg daily, fluoxetine 40 mg daily, and levetiracetam 1000 mg BID or twice daily. Which of the following medications would be appropriate for this patient? So A, we have Xenical, and I put the generic in the parentheses. B is Contrave 9, C is Adipex P, and D is Saxenda. Go ahead whenever you're ready, start putting your answers in the chat. All right, Buggies, Hector. All right. Yes, Anonymous, I will give an explanation. D is Saxenda, yes. Okay, so 1, 2, 3, 4, 5, 6, 7, 8. Anonymous, I would say pick. I just got it. Anonymous, got it. I would say just pick one, but keep both of them in your mind. All right. So the more majority of the students today picked, or attendees picked D as in dog for Saxenda. And let's break it down. So we'll start with D. Um, Saxenda is incorrect. And the reason, oh, I'm sorry, just a second, just a second. Everyone, hold on. My apologies, I was looking at the wrong question explanation. D is correct. So great job, everyone. That is a very, very good sign. So, as you know, we talked about BMI over 30 for obesity. We talked about the health risks, such as heart disease, diabetes, and stroke. And what we need to recognize here is which medication could be causing weight gain. And so we know that the patient is not a candidate for Xenical because it's contraindicated in pregnancy, chronic malabsorption syndrome, and cholestasis. And there are two doses. Xenical is in 120 milligrams, Ali is in 60 milligrams. And they can be taken twice a day or 3 times a day. And so, good job not choosing A. B is incorrect because Contrave is contraindicated in chronic opioid use, uncontrolled hypertension, and history of seizure disorder, bulimia or anorexia, and also pregnancy. There's quite a few others. Mal eyes, abrupt cessation of alcohol, benzos, barbiturates, and other anti-epileptic drugs. So, because this patient has a past medical history of seizure disorder, we're not going to choose Contrave. Great job not choosing that one. C is also an incorrect choice. Adipex P, which is phentermine, is contraindicated in patients with a history of cardiovascular disease. That's the big one. And this patient has an elevated blood pressure. Other contraindications are hyperthyroidism, glaucoma, history of drug abuse, and then same within 14 days of mal eyes. And if you recall, phentermine is only FDA approved for short-term use with lifestyle modifications. So great job not choosing that. So now let's understand why D is the correct choice. And I have a feeling most of you know because you picked the correct answer. So Saxenda or liraglutide is contraindicated in patients with a history of or a family history of MTC, which is medullary thyroid carcinoma, or MEN2, which is multiple endocrine neoplasia syndrome. Also, Saxenda is contraindicated in pregnancy. So this patient uh, is there's nothing in the history about pregnancy, and so we're able to go with this one. So liraglutide is a GLP-1 agonist, and it's available as a sub-Q injection. There's another brand name you may be familiar with, and that's Victoza. However, Victoza is only FDA approved for the treatment of type 2 diabetes. Another thing that you should know about these two medications, Saxenda and Victoza, the maintenance dose for Saxenda is higher at 3 mg daily, and Victoza is 1.8 mg daily. Knowing the dosage and the step ups are important for this class of medication outside of weight loss. And that's something I like to do in my sessions with my students is as much as we can touch, whether it's an area, whether it's a topic, and we can tie it in with others. That really helps when you're taking the Naplex because you never know what they're asking, and it may be several areas, 1, 2, and 3, or 4 and 6, and you want to be prepared for that. A couple adverse effects for liraglutide are nausea, diarrhea or constipation, increased heart rate, and injection site reactions. That's a technique you can use if any medication is an injectable, whether it's sub-Q or IM. Injection site reaction is a great go-to. You probably remember when you were learning oral medications, nausea, vomiting, headache, diarrhea, constipation, all of that can be possible. All right. So, let's see. I think that is it. I was planning to go a little longer, but we went very smoothly. So that's excellent. So I'm going to